gave away part of it, but BPH, again, it's benign. It's not cancerous. So hyperplasia, now you have this excessive growth. So what happens? The prostate actually gradually enlarges with age in men. And the funny thing is that 90% of men over 70 years old have BPH. So, of all the men taking this class and at the university, most of us will develop BPH over our lifetime, assuming we get to 70 or plus. And then the thing is that BPH also causes increased prostate specific antigen. So, the PSA test is often used to, say, is this elevated? Maybe there is prostate cancer, but you can't rely on it alone. Again, why? Because the BPH, if a man is older and he has this BPH, it could cause a false positive. It looks like there's increased PSA due to prostate cancer, but maybe it isn't. Maybe it's just due to enlarged prostate. Okay, so again, back to the prostate. So what happens? So say you have your grandpa or someone elder, one of your loved ones who's an elderly male. Well, what if he has BPH? How does this affect men's health? Well, again, remember what runs through the prostate. You have the prostatic urethra and you also have the ejaculatory duct. Let's talk about the urinary system again. So what happens when, again, the bladder fills up with urine, and then ideally it should flow freely once you release the internal and external urethral sphincter and allow the flow of urine out through the external urethral orifice. Now, what if you have BPH? So again, this is free flowing. Well, if you have BPH, remember hyperplasia referring to the bit enlargement of this prostate tissue. So what happens if this enlarges? Well, what do you think it's going to do to that prostatic urethra? As there's more cells in the prostate itself, it's going to start crowding that urethra until it starts getting narrower and narrower. And what happens to the flow through a tube if the radius gets smaller and smaller due to it being pushed by that prostate around it? Well, it's going to impede flow. So that's why elderly men, they often complain about having difficult urinating, especially if they have a swollen prostate. As that prostate swells up, that narrows the prostatic urethra, so that bladder is going to have a hard time forcing urine through this very narrow tube. But again, is that the only tube that runs through the prostate? Remember, you also have the ejaculatory duct, and you have the seminal vesicles up here. So remember, that's contributing to the semen and also the prostatic secretions as well from the prostate. So ideally, like during ejaculation, what happens? Well, you're having all the sperm mixed with all the secretions from the seminal vesicles, the prostate, and the Cowper's glands down here. But what happens if the prostate swells up? Well, it's just like the prostatic urethra. If this starts swelling up with all this enlarged tissue, it's going to narrow the ejaculatory duct from all that tissue pushing in on it. So what's going to happen during ejaculation? Well, the thing is that if this fluid is building up and this tube is very narrow, it's going to be really hard to force all the semen and sperm through this ejaculatory duct. So they often sometimes complain about pain here. Why? Well, if this is having a hard time pass through, this is going to build up here as well. So this is why a swollen prostate can cause discomfort in elderly men or men who have this BPH. Okay, so how do you tell between BPH and prostate cancer? So again, prostate cancer is a growth, and it's a cancerous growth in the prostate. And remember that both BPH and prostate cancer increase the amount of prostate-specific antigen. So what's one easy way you can tell between BPH and prostate cancer? Well, do a prostate exam. So again, where is the prostate located? Notice it's right here. So do you think a doctor should just take a medical instrument and then cut through all this tissue to get here? What's an easier way to get to the prostate? Well, things like what you can do is again, remember, benign prostatic hyperplasia, you have this growth here, but prostate cancer, you actually have a tumor growing here. So remember our female reproductive lectures? So the thing about tumors, they tend to, compared to normal tissue, they tend to be very tough, very hard. So you can actually feel a tumor as something that's harder than the surrounding normal tissue. So how should we feel this hard tissue? Do we want to press here? Or do we want to press through here? Can we press to the abdomen? No, too much here. We have our bones here. But what's another way we can approach it? Hey, maybe we can approach it from here. So the thing is that this is often why men have to they have to relax And then what does the doctor do? Well, again, they use their finger, they go up into the rectum, and then they try to tap here and palpate there to see if there's any cancerous growth. So again, this is why as a man gets older, that they have to keep on doing these prostate exams. Why? So that their doctor knows like what their normal is, what their prostate feels like, and if there's any hard growth sets over here, maybe they'll do a biopsy to see if it really is a cancerous growth due to a change in texture or hardness. So again, it's not very deep. All it has to go, yes, it does have to go up in the rectum, but it's not like it's the whole finger all the way up here. Again, the prostate is pretty close, only like around 1.5 to 2 inches from the actual anus. So again, it's not the whole finger. So this is another reason why it's like, and it's non-invasive, well, relatively non-invasive. So you don't have to cut anything, but compared to other ways, it's just like a pelvic exam for guys. Okay, so prostate cancer also has a genetic component. So what do I mean by that? So the thing is that there's an increased risk in African American men for prostate cancer. And this is always, I mean, whenever I bring up things like genetics and race, there's like, okay, why do we have to talk about that? Well, the thing about this is it's important to know why, because we see statistically they're 50% more likely to develop prostate cancer, and then twice as likely to die from prostate cancer. So often when we notice that the population tends to get certain types of cancers more than others, we start screening earlier than usual. So maybe someone who's of African American descent, he might start screening earlier because again, so that's why it's often when the doctor asks you about your racial background, they're actually saying like, okay, what are you at increased risk of? And should we start screening earlier for these diseases? So they know that to be on the lookout. And locally, so Polynesians, things like Native Hawaiian and then Samoans, Tongans, they're more likely to be diagnosed with late stage prostate cancer. So late stage meaning that prostate cancer was already there and it's being grown very large and started to spread to other tissues. And it's really hard to contain prostate cancer once it spreads to other tissues. So the earlier you detect it, the better. That's why things like genetics matter, and also filling out those forms, because again, if you fall in a high risk category, your doctor might say, okay, let's start screening for these cancers earlier.